And it goes a little something like
a pleasant day to everyone. So today, we're going to discuss about the autonomic nervous system. First, I'm going to discuss the divisions of the autonomic nervous system. The characteristics of somatic nervous system. We have letter A, the effectors or the target organ, which is the skeletal muscles. It associated with the voluntary controls of the body movements. Like our skeletal muscles, under voluntary control, receive signals. For example, walking in the forest. Letter B. We have the efferent pathways and ganglia. The cell body of the lower motor neuron is in the central nervous system, the spinal cord ventral horn, and axon synapses with skeletal muscles. We have the neurotransmitter, which is the acetylcholine, is excitatory to skeletal muscles. It plays a role in motivation, arousal, attention, learning, and memory. The amount of myelination and the neurons are highly myelinated. So remember, the somatic nervous system is the nervous system that is responsible for voluntary control of our muscles.
Hi everyone, my assigned topic is characteristic of autonomic nervous system. What is autonomic nervous system? Autonomic nervous system is component of peripheral nervous system that regulates involuntary physiologic processes including heart rate, blood pressure, respiration, digestion, and sexual arousal. Effector or target organs are cardiac muscle, smooth muscle, and glands. Cardiac muscles is tissue found only the heart and is responsible for ability of the heart to pump blood. Its function is to cause the mechanical motion or pumping blood throughout the rest of the body. And also cardiac muscles is called heart muscles or myochondrium. Smooth muscle is an involuntary non-threaded muscles because it has no sarcomeres and therefore no striations. Smooth muscles is divided into two subgroups, single unit smooth muscle and multi-unit smooth muscle. Smooth muscles is present throughout the body where it serves a variety of functions. For example, in the eye, the ciliary muscle, a type of smooth muscles, dilate and contract the iris and alter the shape of the lens. The next is intestine. Intestine is help with digestion and nutrient collection. Next is urinary system to help ID the body toxins and works in electrolyte balance. The next is the gland. Gland is our organ which produces release substance that perform a specific function in the body. Example of major glands in our body are hypothalamus, pituitary, thyroid, parathyroid, adrenals, pineal body, the ovaries, and the testes. The next is effector pathways and ganglia, the motor unit of ENS or autonomic nervous system. There are two neurons chain. The kinds of neuron chains is pre-ganglionic neurons and the post-ganglionic neurons. Free ganglionic neurons, a neuron of the autonomic nervous system, whose body lies in the central nervous system and whose axons terminates in a peripheral ganglion, synapsing with postganglionic neuron. The function of preganglionic neurons are the neurons of the autonomic nervous system responsible for conveying nerve impulse from the central nervous system to the autonomic ganglia. Preganglionic action, a fiber cell body which is located in autonomic nucleus in the spinal cord or brainstem, and the axon which terminates in the autonomic ganglion found in the nerves conveying sympathetic or parasympathetic. A function of preganglionic action is that activates nicotinic acetylcholine receptor or postganglionic neuron. Postganglionic neuron is pertaining to the nerve fibers whose cell bodies are in the ganglia or the autonomic nervous system and to any synaptic connection with these fibers. The function of postganglionic neurons are directly responsible for changes in the activity of the target organ via biochemical modulation and neurotransmitter release. The next is utilize neurotransmitter and their effect. There are specific terms: acetylcholine, norepinephrine, epinephrine, and the amount of myelination. Acetylcholine is the chief neurotransmitter of the parasympathetic nervous system. It means parasympathetic nervous system is fight to fight or uh, rest. It plays a role of motivation, arousal, attention, learning, and memory, and is involved promoting sleep. That the role of acetylcholine. The norepinephrine is another term of noradrenaline. It increases heart rate and blood pumping from the heart. Mag-increase yung blood, increase the heart and blood to pump the heart. It also increase blood pressure and help break down fats and increase blood sugar levels to provide more energy to the body. The effect of norepinephrine is involved in the sympathetic fights or fight response of those insensitive to environment challenges and can modulate behavior accordingly. The noradrenergic system has been shown to immediate behavior, particularly aggression, in animals as well in the psychiatric illness. Yes, if the norepinephrine activated, usually in animals, that cause illness because uh, of the activated of norepinephrine. The epinephrine is a hormone released from the adrenal medulla and respond to stress immediate from sympathetic fibers. If you feel a stress, the hormone released to the adrenal medulla response immediately from sympathetic fibers. Sympathetic fibers is nerve systems inactivate in the stressful situation. Stimulation effect of epinephrine is strong emotion. If you have strong emotion such as fear or anger, the cause of epinephrine be released into the bloodstream, then which cause an increased heart rate, mo increase ang heart rate, then mo increase ang muscle strength, Then mutaas ang blood pressure and the sugar metabolism. The inhibitor effect of epinephrine is also did not inhibit the stimulation uptake by insulin. If you uptake the insulin, the epinephrine is did not inhibit. Uh, Epinephrine decrease the phosphorylation because you take insulin, the epinephrine decrease the phosphorylation or to the deoxyglucose. However, it causes the extracellular accumulation or free glucose. Amount of myelination of pre-ganglionic neurons and post-ganglionic neurons. The pre-ganglionic neurons is yes, they have amount of myelination because actions pre-ganglionic neurons are mostly myelinated relatively show the conducting fibers. Those actions knives on the cell body of post-ganglionic neurons, which are located in all cases outside the CNN or uh, central nervous system. Post-ganglionic neurons are unmyelinated because the post-ganglionic nerve fibers of the parasympathetic nervous are shorter.
Good day everyone. My name is Rowelyn Regis from the BS Ed Science 1, and we're going to talk about the two divisions of the autonomic nervous system. So first, what is autonomic nervous system? Autonomic nervous system is a component of the peripheral nervous system that regulates involuntary physiologic processes including heart rate, blood pressure, respiration, digestion, and arousal. So, ang nervous system diya, autonomic nervous system, siya regulate kung sa process natong heart rate and blood pressure. So, it has two distinct divisions. The sympathetic, the fight or flight, and the parasympathetic, rest and digest or feed and breathe. So, origin of the nerve fibers. So, when we say origin, nagmula. So, parasympathetic fibers originate in cranial sacral regions of the spinal cord. Ang sympathetic fibers originate in thoracic and lumbar regions of spinal cord. So when we say cranial, it is the bones of the head that covers the brain. And when we say sacral, at the bottom of the spine and lies between the fifth segment of the lumbar spine. So ang parasympathetic, dito siya nagikan sa, when we say cranial manggod, top, ayan siya, covers the brain, so top siya. Then, ang sacral, between the fifth segment of the lumbar spine and the tailbone. So, dapit siya sa last sa spinal cord mo part. Ang sympathetic is originated in thoracic and lumbar regions. Thoracic means middle. So, naa siya sa tunga-tunga. And ang lumbar, naa siya sa last Japon sa lower. So, kung ang parasympathetic, nagsugod siya sa, naa siya sa babaw kasugod, then, ang sympathetic, naa siya sa middle. So, length of the nerve fibers. Parasympathetic is long preganglionic and short postganglionic fiber, while the sympathetic, short preganglionic and long postganglionic fibers. When we say preganglionic, it is fibers from the central nervous system that connects the central nervous system to the ganglia. So, matapig na to, makuha na nato niya kung unsa ang ganglia because I will tell you later. Ang postganglionic connect the ganglion to the effector organ. So, kung ang parasympathetic is, ang iyang preganglionic is long, sa sympathetic, ang preganglionic niya is short. So, opposite sila. Opposite ang ilang gitas-on. So, next is the location of their ganglia. So, what is ganglia? Ganglia are obvious structures containing cell bodies of neurons and glial cells supported by connective tissue. The information enters the ganglia, excites the neurons in the ganglia, and then exists. So, ang ganglia siya, libali mo siya entrance. Entrance siya sa mga neurons. Mo enter sa ganglia ang neurons, mo exist, then mo exit rapod. So, the location of the ganglia of the parasympathetic located in the visceral effector organ or near it, while the sympathetic located near the spinal cord in the sympathetic chain. So, when we say visceral, it is instinctive. And the effector part of the body, such as muscles and glands, responds to a detected stimulus. Sympathetic chains, ganglionated chain present bilaterally extending from the base of the skull to the coccyx. So the sympathetic chain contains sympathetic ganglia linked together by the myelinated axons forming the sympathetic trunk. So ang sympathetic chain consist or naa siya sympathetic ganglia nga gasumpayay siya para makahimo siyang sympathetic trunk. So posibleng I'll show you I'm going to show you the forma sa sympathetic chain. But don't worry, I'll put it on my PPT presentation. So, masabtan jud ninyo kung asa jud siya ganglia, asa gid siya gasugod, ug aha jud siya ug usay porma sa sympathetic chain.
My assigned topic is this. Letter D, the nicknames, and E, the neurotransmitter. The nicknames of parasympathetic is also called the rest and digest. The 3 Ds are digestion, defecations, and diuresis. The sympathetic, flight or fight. The 4 E's are excitement, emergencies, embarrassment, and exercise. Next, the neurotransmitter. The parasympathetic utilizes acetylcholine at both synapses. The sympathetic utilizes acetylcholine in the first synapses, but norepinephrine or epinephrine at the second synapses.
Okay, so let's proceed with parasympathetic nervous system. The parasympathetic nervous system, or also called as the craniosacral division, because of the origin of the nerves. The parasympathetic nervous system cranial outflow. First, we have the nerve tree, or the oculomotor nerve. It innervates smooth muscles in the eyes that cause the pupils to constrict. Second, we have the nerve 7, the facial nerve. It stimulates lacrimal gland and stimulates salivary glands. Third, we have the nerve 9, the glossopharyngeal nerve. It stimulates the parotid salivary gland. Lastly, the nerve 10, the vagus nerve. It contains 75% of parasympathetic nerve fibers. It affects the following organs. The heart. It decreases steadiest heart rate and constricts coronary veins and arteries. The lungs. It constricts bronchioles and reduces breathing rates. The liver and gallbladder. It expels bile. The stomach. It stimulates secretion of enzymes and increases contraction and motility. The pancreas. It stimulates insulin and secretion and enzyme secretion. Lastly, the intestines. It increases motility. The parasympathetic nervous system sacral outflow. We have the preganglionic fibers, or also called as the pelvic splenic nerves, the S2 to S4 synapse in ganglia within their target organs. First, we have the distal large intestines and the rectum. It promotes defecation. Second, we have the bladder. It contraction of smooth muscles of bladder to promote urination. Lastly, we have the genitalia. It causes erection. The parasympathetic nervous system. D. Division. Digest, defecation, and uresis. Pupils constrict. It stimulates salivary, lacrimal, and pancreas glands. It decreases the heart rate or the blood pressure. It causes contraction and emptying of hollow organs. The bladder, the gallbladder, the stomach, and the intestines. Vasodilation of penis or erection. Minimal on blood vessels and bronchioles.
Sympathetic nervous system, also called the thoracolumbar division because of the origin of the nerves. It is more complex than the parasympathetic division because it innervates more organs which are both viscera and somatic. The photo shows the sympathetic innervations of the distributions of nerves in or to a part. Sympathetic nervous system is known as the E division, which is exercise, excitement, emergency, and embarrassment. Its functions are to dilate pupils, inhibits secretions of digestive glands, stimulates sweating, stimulates erector pili, stimulates adrenal medulla to secrete EP and norepinephrine, increases heart rate or BP, decreases digestive processes, decreases urine output, causes ejaculation, stimulates glycogenolysis in liver, glucose or release, blood vessels constriction or dilation and blood coagulation, and bronchial dilation. Preganglionic neuron axons or between spinal cord and ganglion, which are small in diameter and myelinated. White ramus communicans and usually synapses with several postganglionic neurons are parts of how the sympathetic nervous system works. The possible routes of exit of sympathetic axons. 1. Spinal nerves. Preganglionic axon synapse with postganglionic neurons at same level. Their axons enter sympathetic chain or may pass superiorly or inferiorly, and synapse with postganglionic neurons at different levels from where their axons enter the chain. B. Postganglionic axons or unmyelinated leave chain as pass through gray ramus communicans and re-enter spinal nerve. C. Innervate sweat gland, smooth muscle in blood vessel of skin or bones, and erector pili in skin. 2. Sympathetic nerves. After preganglionic neurons, synapses as described for spinal nerves, postganglionic axons leave chain in a sympathetic nerve. B. Innervate heart muscle, thoracic blood vessel, smooth muscle of esophagus and lungs, and parasympathetic nerves, plexus near the carotid artery, the head and neck sweat glands, salivary glands, smooth muscle in blood vessel, the eye, and arrector pili.
Splanchnic nerves. Splanchnic nerves are paired visceral nerves, nerves that contribute to the innervation of the internal organs, carrying fibers of the visceral efferent fibers as well as sensory fibers from the organs. Visceral efferent fibers all carry sympathetic fibers except for the pelvic splanchnic nerves, which carry parasympathetic fibers. According to NCBI, there are 5 types of splanchnic nerves on both sides of the spinal vertebrae including cardiopulmonary, thoracic splanchnic, lumbar splanchnic, sacral splanchnic, and pelvic splanchnic nerves. The splanchnic nerves arise from the sympathetic thoracic trunk to innervate the abdomen. Some preganglionic axon originating at T5 to 12 interchain ganglia but exist at the same or different level, without synapsing as splanchnic nerves going to collateral prevertebral ganglia to synapse with postganglionic neurons. Collateral ganglia are in the abdomen close to our major arteries, for which they are named, arise from the abdominal aorta, which are cilia, superior mesenteric and inferior mesenteric. Innervate abdominal pelvic structures, moat, muscle and walls of blood vessels and organs or glands. Example, pancreas, liver, and prostate. Innervation of adrenal medulla. Innervation of adrenal medulla, composed only of preganglionic neurons whose axon synapse with cells of adrenal medulla. 80% of cells secrete epinephrine and 20% secretes of norepinephrine into bloodstream. Enhance and prolong effects of sympathetic libation.
Neurotransmitter drugs that affect the autonomic system. Drugs are so commonly used and abused in modern societies that virtually everyone has some familiarity with the concept of drug addiction and abuse. Drugs that affected behavior are particularly liked to be taken and exist within the behavioral effects are considered pleasurable. There are 4 specific categories of drugs on how the effect of ANS or autonomic nervous system. First, cholinomimetics or cholinesterase antagonists. Second, anticholinergics. Third, adrenoreceptor agonist sympathenomimetics. And the last is adrenoreceptor antagonist. The cholinomimetics or cholinergic drugs. It means drugs that cause effects similar to those resulting from introduction of acetylcholine or stimulation of ganglions of the parasympathetic nervous system. These drugs imitate action of endogenously released acetylcholine. Cholinomimetics can be classified as direct-acting or receptor agonist and indirect-acting cholinomimetic drugs. Examples of cholinomimetic drugs contraindications are the bronchial asthma and the peptic ulcer. So what is anticholinergic? Anticholinergic are also called parasympatholytics, meaning they block acetylcholine at the muscarinic receptors in the parasympathetic portion of the autonomic nervous system. The muscarinic receptors are in the heart, G-tract, bronchi, glands, and eye when the parasympathetic system is activated by anesthesia, bradycardia, gaze stimulation, salivation, and pupil constriction may occur. Here are the side effects of anticholinergics. It includes dry mouth, blurred vision, dry eyes, constipation, urinary retention, dizziness due to drop in blood pressure and standing or postural hypotension, cognitive problems or confusion, and heart rhythm disturbance. Next, the adrenoreceptors agonists or sympathomimetics. It means drugs that act like sympathetic stimulation. These drugs differ from one another with respect to the degree to which they stimulate different sympathetic effector organs and durations of actions. What are the side effects of sympathomimetics? Sympathomimetics can cause the following side effect. includes bad taste in the mouth, chills, constipation, diarrhea, dry mouth, excitement, hair loss, headache, impotence, insomnia, and tremor. Acetylcholine and norepinephrine are the major neurotransmitter released by ENS or autonomic nervous system. Acetylcholine is released by 4A, all ENS or autonomic nervous system preganglionic axons. That means the axons of preganglionic neurons release acetylcholine or near the target organs. Most postganglionic neurons release acetylcholine onto target organs, although some release nitric oxide. 4B, all parasympathetic postganglionic acetylcholine. So it means acetylcholine released by all parasympathetic postganglionic neurons and some sympathetic postganglionic neurons traveling to sweat glands bind to these receptors. Muscarinic receptors may be either inhibitory or excitatory depending on the tissue upon which they are found. For letter C, cholinergic axons fibers release acetylcholine. The system of cholinergic nerve fibers that release acetylcholine at their disease is widespread in both the central and peripheral nervous system. In the periphery, all the preganglionic fibers are cholinergic, sympathetic, postganglionic, and the motor fibers that innervate the voluntary skeletal muscle. In the nervous system, the cholinergic system has extensive. For number 2, norepinephrine is released by most sympathetic postganglionic axons. For A, adrenergic axon fibers release norepinephrine. It means adrenergic axon fibers release in norepinephrine. Postganglionic fibers in the sympathetic divisions are adrenergic. Unused norepinephrine are also called noradrenaline as a neurotransmitter. In the sympathetic nervous system, the postganglionic neurons of sweat glands release acetylcholine for the activation of muscarinic receptors.
There are two types of receptors. First, cholinergic receptors. Cholinergic receptors are receptors on the surface of cells that get activated when they bind a type of neurotransmitter called acetylcholine. There are two types of cholinergic receptors called nicotinic and muscarinic receptors, named after the drugs that work on them. The nervous system is divided into the central nervous system, so the brain and the spinal cord, and the peripheral nervous system, which includes all the nerves that connect the central nervous system to the muscles and organs. The peripheral nervous system is divided into the somatic nervous system, which controls skeletal muscles, and the autonomic nervous system, which is further divided into the sympathetic and parasympathetic and controls internal organs. Neurons are the main cells of the nervous system. They're composed of a cell body which contains all the organelles and nerve fibers, which are projections that extend out from the neuron cell body. Nerve fibers are detritus that receive signals from other neurons and axons that send signals along to other neurons. Where two neurons come together is called a synapse. That's where an axon releases neurotransmitter that bind to receptors present on the cell membrane of the detritus, or the cell body of the next neuron in the series. Now, the autonomic nervous system, so both sympathetic and parasympathetic, is made up of a relay that includes two neurons. Preganglionic neurons, which have their cell bodies in nuclei throughout the spinal cord, and postganglionic neurons, which have their cells bodies in ganglia out of the spinal cord. Action of preganglionic neurons exit the spinal cord to reach the ganglia and synapse with postganglionic neurons. Then, the action of postganglionic neurons exit the ganglia to reach the organs and synapse with the target organ cells. In the somatic nervous system, the site where a motor neuron axon comes into contact with a skeletal muscle fiber is called a neuromuscular junction. Whenever a motor neuron receives an electrical impulse from the brain, that triggers the release of small vesicles that contain acetylcholine into the neuromuscular junctions. Acetylcholine then binds to the nicotinic receptors on skeletal muscle cells and triggers skeletal muscle contraction. Now, the nicotinic receptors are also called ionotropic acetylcholine receptors because there are ligand-gated ion channels, which means that they open when acetylcholine binds, allowing positively charged ions like sodium and potassium to flow through them. Nicotinic receptors are made of 5 subunits, 2 alpha and 1 beta, 1 gamma and 1 delta subunit, and together they form a tunnel that's generally closed. When the acetylcholine binds to the alpha subunits, the tunnel changes shape and opens up. That lets sodium flow into the cell and potassium out of the cell. Following a passive gradient, this leads to depolarization of the cell, which is when the cell undergoes a shift in electric charge distribution and becomes more positive, triggering a cellular response. Muscarinic receptors are also known as a metabotropic acetylcholine receptors because they activate intracellular proteins when acetylcholine binds. Muscarinic receptors are 7-pass transmembrane receptors, which means they are really long protein that have one end that sits outside the cell and binds acetylcholine. Then the snake-like protein dips in out of the cell membrane 7 times and finally ends up the inside of the cell. The ends of the protein within the cell activates intracellular proteins. So, muscarinic receptors are one type of G protein coupled receptors or GPRS because they work directly with intracellular proteins called guanine nucleotide binding proteins or G proteins because they bind to guanosine, a diphosphate or GDP when they're inactive, and to guanosine triphosphate or GTP when they're active. Second, adrenergic receptors. Adrenergic receptors are membrane-bound proteins that imitate the peripheral and central actions of norepinephrine and epinephrine by virtue of their location, either presynaptically or postsynaptically on neurons or effector organs such as the heart, vasculature, and adipose tissue. This class of receptors mediate a wide range of important homeostatic response. Adrenergic receptors were originally divided into two major groups, alpha and beta. So, alpha adrenergic adrenergic receptors play an important role in the regulations of blood pressure, BP. There are two principal types of alpha receptors, alpha 1 and alpha 2, and both participate in circulatory control. Alpha 1 receptors are the classic postsynaptic alpha receptors and are found on vascular smooth muscle. They determine both articular resistance and venous capacitance, and thus BP. Alpha 2 receptors are found both in the brain and in the periphery. In the brainstem, they modulate sympathetic outflow. Their function in the periphery is not yet fully understood, but they may contribute both to control of sympathetic tone and to local and regional blood flow. Drugs that enhance central alpha-2 activity such as clonidine, guanfacine, the active metabolite of methylopal, can significantly lower BP and are effective in the long-term control of hypertension, either alone or in a combination with other drugs. So, beta-adrenergic receptors. So, beta agonists bind to the beta receptors on the various tissue throughout the body. So, beta-1 receptors are predominantly found in three locations: the heart, the kidney, and the fat cells. So, the beta-1 adrenergic receptor is a G protein, a coupled receptor communicating through the GS-alpha subunit by signaling GS. A COMT-dependent pathway is initiated through adenylyl cyclase, and this results in potentiation of the receptor's function. So, in the kidney, smooth muscle cell is the junctaglomerular apparatus contract and release renin. This cascading effect will eventually increase blood volume through the actions of angiotensin and aldosterone to the adipocyte. The beta-1 receptor is targeted to upregulate lipolysis.
Now we talk about drugs. Drugs is a substance intended for use in the diagnosis, cure, mitigation, treatment, or prevention of the disease. There are 5 classifications of drugs. First is the atropine. So the question is, what is atropine and how it is used? Atropine is a prescription medicine used to treat of symptoms of hollow heart rate or bradycardia, reduce salivation and bronchial secretion before surgery, or as an antidote of overdose of cholinergic drugs or mushroom poisoning. Atropine may be used alone or with other medication. Atropine belongs to a class of drugs called anticholinergic or antispasmodic agents. So, what is the possible effects of atropine? Atropine may cause serious side effects including fast heart rate, high pressure in the eye or glaucoma, abdominal blockage or pyloric obstruction, worsening urinary retention and mucus in your airways, or viscid bronchial plaques. The most common side effect of atropine includes dry mouth, blurred vision, sensitivity to light, lack of sweating, dizziness, nausea, loss of balance, hypersensitivity reactions, or skin rash and rapid heart rate. And the second is the neostigmine. Neostigmine is a parasympathetic, especially a reversible cholinesterase inhibitor. The drug inhibits acetylcholinesterase, which is responsible for the degradation of acetylcholine. So with acetylcholinesterase inhibited, more acetylcholine is present. By interfering with the breakdowns of the acetylcholine, neostigmine indirectly stimulates both nicotinic and muscarinic receptors, which are involved in muscle contraction. It does not cross the blood-brain barrier. Here are the common side effects of neostigmine: excessive saliva production, excessive sweating, nausea, vomiting, diarrhea, and stomach cramps. Number 3. Albuterol. Albuterol is a bronchodilator medication which increases the flow of air through the bronchial tubes by relaxing muscles in the airways. It is also the beta-2 adrenergic agonist, letting the beta blocker block the action of epinephrine and norepinephrine in the body. It is also used to treat and help prevent shortness of breath, wheezing caused by asthma, emphysema, chronic bronchitis, and other respiratory diseases.
4. Ephedrine. What is ephedrine? Ephedrine is a central nervous system, a stimulant used to treat breathing problems, nasal congestions, low blood pressure problems, or myasthenia gravis. Ephedrine is also used to treat narcolepsy, menstrual problems, or urine control problem. What are side effects of ephedrine? The common side effect of ephedrine usually occurs with a larger doses and include nervousness, anxiety, dizziness, spinning sensation, headache, nausea, loss of appetite, trouble sleeping, fast heart rate, palpitations, sweating, vomiting, weight loss, and difficult or painful urination. So ephedrine during pregnancy and breastfeeding. Ephedrine should be used only when prescribed during pregnancy. It is not known whether this drug passes into breast milk due to the potential risk to the infant. Breastfeeding while using this drug is not recommended. Number 4. Beta blockers. Beta blockers are one of the most widely prescribed classes of drugs to treat hypertension and are a mainstay treatment of congestive heart failure. Beta blockers work by blocking the effects of epinephrine and slowing the heart's rate, thereby decreasing the heart's demand of oxygen. Long-term use of beta blockers help manage chronic heart failure. Examples of beta blockers: acebutolol, acetonolol, bisoprolol, carvedilol, esmolol, labetalol, metoprolol, propranolol. That is the examples of beta blockers. So what do beta blockers treat? Doctors often prescribe beta blocker for this heart condition: heart failure, high blood pressure, angina, abnormal heart rhythms, heart attack. So beta blockers can also treat glaucoma, migraine headache, anxiety, certain types of tremors, or hyperthyroidism. If you have asthma or COPD, your doctor may not prescribe a beta blocker because it may your breathing symptoms worse. If you have heart failure and severe lung congestion, your doctor will treat you congestions before prescribing a beta blocker. How to take a beta blocker? You can take them in the morning at meals and at the bedtime. When you take them with food, you may have a fewer side effects because your body absorbs the drug slower. Follow the label direction and how often to take it. The number of doses you take each day the time allowed between doses, and how long you need to take the medication will depend on your condition. Older people typically take lower doses. Ask your doctor what to do if you miss a dose. While you're taking a beta blocker, you may need to check your pulse every day. If it's lower than it should be, contact your doctor about taking your beta blockers that day. Never stop taking a beta blocker without speaking to your doctor first. Even if you feel that it's not working, sudden withdrawal can worsen angina and can cause heart attacks. So, mga side effects, side of beta blockers are common but usually mild. They include fatigue, cold hands, upset stomach or diarrhea or constipation, headache, dizziness, shortness of breath, trouble of sleeping, loss of sex, drive, and depression. If these symptoms don't go away or become severe, contact your doctor. You should take beta blockers if you have low blood pressure or a slow pulse because bringing down your heart rate more can cause dizziness and lightheadedness. While pregnant or breastfeeding, beta blockers may affect a growing baby by slowing its heart rate and lowering its blood sugar level and blood pressure. These drugs can also pass to as an infant through breast milk, causing low blood pressure, trouble breathing, and a slow heart rate. So you should tell your doctor if you're trying to get pregnant or you become pregnant while on beta blockers or are breastfeeding. That's all, and thank you for listening.